Hello, everybody. My name is Michael Gallagher. Today, we're going to talk about natural solutions for women's health. I'm here down at the Weiner Wellness Center. We have a huge event going on this week. We encourage everybody to come down. There's tremendous specials, free samples, all kinds of great stuff here going on. But today they asked me to speak about women's health. This is very, very common questions that we get often asked about. So I'm just going to share with you some of the things that I've seen clinically work through the years and at what dosage, because that is also extremely important. For those who don't know me, I'm a certified lifestyle educator. I've been in the health industry for over 28 years. I've been in the professional side, working with all different types of doctors for the last 18 years. So again, I'm going to just share with you some of the basic concepts. But if you want more specialty, I always advise making up an appointment with Ashley Razi, who really focuses on the food aspect, and that's a huge component, of course, of your health, or Jeff Nisnik, who can do kinesiology muscle testing and do reverse allergy treatments, which is also very, very important as well. Okay, so let's get into it. We have a lot of major formulas we're going to talk about, covering a lot of different things, but you can also email us if you have any specific questions on these things as well. Okay, so let's talk about some, first of all, basic foundation, and that is our Women's Complete. Okay, so we pull it up here. Okay, so we know there's lots of multivitamins out there in the market, but there's not one like this, folks. Okay, we actually worked with several holistic OBGYNs. It took us several years to develop this, and we feel that without a doubt, this is very, very unique. So a multi is just kind of filling in the gaps of our regular food. Of course, we want you to eat healthy foods, organic as much as possible. Again, a whole array of fruits and vegetables, of course. But we know a lot of people don't do that on an everyday consistent basis. So if we look at the formula here in detail, of course, it has your vitamins, and we're using very absorbable forms. And you always want to pay attention to the B6, which is the peroxyphosphate phosphate, the active form. You want to look at the B12 as well. Okay, so that's the methylcobalamin, also the active form. And then you want to look at the type of folic acid they're using. And we're using quadrifolate, fourth generation folic acid. So even those who have genetic SNP, known as MTHFR, this is totally safe. So when it comes to a multivitamin, these are the three things that you should always look at, because this will tell you if they're cutting any corners. Okay, so that's the first step when you look at that. Then we take a look at your minerals, and we're using all the Albion form of minerals here. This is the best of the best. And when it comes to minerals, again, minerals are very difficult for your body to break down. So again, the technology they're using, no one else has in the industry, and it makes sure you're getting the most absorbable minerals. And then we added probiotics. So this is not just a multivitamin. This is a multivitamin plus probiotics. This is very, very unique, including lactospore. So lactospore is a special trademarked form of probiotics. So it's helping with the gut health. It's helping with UTIs. It's helping with urinary tract issues, specifically geared for female hygiene issues. So this takes it to a totally different level. We have DMG, which will help. Your key methylator will help with absorbability of all your vitamins and minerals. And then we have a blend of superfoods. Again, things typically people are not eating on a consistent basis. Cranberry, broccoli, garlic, spirulina, celery seed, chlorella, all fantastic. So we put a blend in there as well. And then you look at all the different trademarked ingredients. So we talked about the Albion. TRAC stands for, by the way, the real amino acid chelators. Ferroshell is the trademark form of iron. Quadrifolate, we just talked about as far as absorbable folic acid. Vita MK7 is the most absorbable K2 that we've seen on the market. Vitacholine, excellent for the brain and the liver, trademark form of choline. And then there's that lactospore. So folks, 7 different trademarked ingredients in this multi. So this can be used as a prenatal, fantastic for that, all the way through, all throughout the aspect of a female. And so typically recommended, it's really based on your diet. So on days you're not eating healthy, shall we say, I always suggest 4 a day, fill in those gaps. Days you are eating healthier, I would recommend at least 2 a day. If you are pregnant, if you are nursing, we would recommend 4 a day because you are eating for more than one, of course. But even though this is geared for female, as we like to say, made for women, but it is strong enough for a man. So men can also take this. There's no issues with it as well. So again, so female can share with their spouse, with their partner, as far as the multivitamin aspect of it. So very unique, basic foundation when it comes to female health, as far as vitamins, minerals, and probiotics. You get it all in this one formula, folks. So very unique. I've had numerous people tell me that within a week of taking just 2 a day, they can feel difference, which you don't typically hear about from a multivitamin. But I hear that over and over again. They have more energy, their GI improves, so forth and so on. So again, when it comes to multivitamins, please try this and see if you don't feel a difference. Okay. The second thing that we wanted to discuss today is hormonal health. All right. And this is a big topic. I'm going to try to simplify this for as much as possible. But as from a moment a female starts their menstrual cycle, we know there is can be hormonal imbalances happening. And so I always try to keep this as simple, like I said. So I always remember the movie that Clint Eastwood made famous. When it comes to hormones, there's the good, there's the bad, and there's the ugly. Okay. So this formula, Astro Cleanse, is trying to eliminate the bad and the ugly as quickly and efficiently as possible. Okay, just leaving the good. When we leave the good, it also indirectly rebalances progesterone. Okay, so even though this is called Astro Cleanse, it also will help with progesterone, whether it's high or low. Estrogen is high or low. Whether progesterone is high or low, this will rebalance it. If you're already doing compounding pharmacist, working with a compounding pharmacist on with hormones and progesterone, this was totally safe. It will complement it. Absolutely. And so we work with a lot of different pharmacies that use this formula very, very successfully throughout the country. When we talk about the bad estrogen, we're talking about everything from irregular bleeding to spotting to cramping to hot flashes and night sweats. So this formula, we've had tremendous clinical response with through the years. It helps with all those issues. So again, when we're discussing these things, might not pertain to you, but you might know somebody who does. So keep that in mind as well. When we say, the ugly estrogen, we're talking about hormonal cancer, breast cancer, uterine cancer, things like that, as far as on that level. So that's what we're referring to there. Okay, so what's in it that makes this so special? All right. So there's really 3 main ingredients here that are helping to rebalance hormones. Okay. We have indole 3-carbinol, okay, known as I3C. That is from your cruciferous family. So that ingredient's been known in the industry many, many years now, going over 40 years. When we chew on these cruciferous vegetables like broccoli, as we say, Brussels sprouts and so forth, when we keep chewing and chewing and chewing, it eventually becomes this metabolite, indole 3-carbinol. And again, this is your main ingredient that helps with these type of estrogen issues. So that is the first step in this process. Then about 30 years ago came out DIM. If you continue to keep chewing those cruciferous vegetables, it creates this compound known as DIM, which again further enhances that estrogen balance. Okay. So those two are very well known in the nutritional world. We do sell DIM, by the way, just by itself, called DIM Pro, if you would want that one. All right. But when you combine it with the Endo-3 Carbinol, we get even faster, quicker results, more efficient results. So that is why we like the combination versus just DIM by itself. Then in the last decade has been calcium D-Glucanate. All right. So you might think this is a calcium formula. It actually is not specifically for that. It will help indirectly. All right. But again, from your cruciferous vegetable family as well. And there's even more research on this one for hormonal cancer. So when you combine Endo-3 Carbinol with the DIM, with the calcium D-Glucarate, that combination will give you even faster results when it comes to rebalancing these hormones. And that is what we're trying to do with this formula. And I've seen a lot of different supplements out there. Again, a lot of them you see these individually. Some you might see one or two of these combined, but I've never seen all three. So this is very unique in the industry, folks, combining all that. Then we have other things to help on the inflammation side of the bad estrogen. Curcumin, which is the most researched turmeric on the market. You have decaffeinated green tea. So again, a slight amount. I mean, just less than 6%, less than what you would find in a cup of a decaffeinated coffee. So it won't cause any cardiovascular issues whatsoever. You have the resveratrol in there, very powerful antioxidant. Isabi, which is a trademark form, in there as well, which will help with, again, powerful antioxidant on its own. And you have vitamin E and your tocotrienols, and then the trademark form of bioperine in there, which enhances the curcumin and other ingredients. So you put it all together. This is a fantastic recipe for these type of hormonal imbalances. So what would be the recommended dosage? Well, clinically speaking, for these kind of issues, we would recommend 3 capsules a day. We try to break it up throughout the day, one morning, one noon, one in the evening. Okay. But if you forget, you can always double up on it. But 3 a day, it comes in a 90 cap bottle. Okay. So 90 cap size. So that would be 1 month. Most women that we work with and doctors that we work tell me that they really do notice this within that first month. In fact, one of the biggest challenges that we have with this formula is that most women think they're fixed in 1 month. And the challenge with hormones is it takes a minimum of 3 months. So what I always would tell a female, I know you're feeling better. That's fantastic. But if you stop right now after 1 month, more than likely these symptoms will come back a few months down the line. If you stick with it for at least 3 months, then we are able to stabilize those hormones much greater. And the chance of it coming back is highly unlikely. Now, after 3 months, so 3 bottles, this is really a 3-bottle, 3-month program when it comes to hormones. After 3 months, then we would go down to 2 a day for a bottle. And if everything's still good, then we would go down to 1 a day for a bottle. All right. So it's really more like 3 to 6 months to get those hormones completely stabilized. But that's the whole idea with this. Okay. So if we could only do one thing or afford one thing only when it comes to hormonal issues, it would be this one right here, Astro Cleanse. We've had some incredible results. Now, if it's more serious hormonal imbalance, such as endometriosis, such as polycystic ovary syndrome, such as hormonal cancer. And again, folks, we're not making any claims, and we want to make sure you work with your doctors. And if you're on any medication, this should not interfere, but you always want to work with them. Maybe prescription blood thinners would be the only thing because of the herbals that are in here. But as long as you have an open communication with your prescribing physician, take this at least an hour apart from any of your meds. But if you're having these more serious estrogen problems, we need to be more aggressive for this to help. So clinically speaking, for those issues, we would bump this up to 6 capsules a day. So 2 breakfast, 2 lunch, 2 dinner, or 3 and 3, right? But 6 a day. And again, 3 months minimum. And then let's reevaluate, right? So before you go to surgery, before you go other avenues, let's try 6 a day for this to work.
You're good. Keep going. Keep going.
Okay.
You're good. Keep
All
going.
right. So Philly Phil on helping me out with the computer screen here. So.
Yeah, you're okay. That's good.
All right. So this is always our first approach. This is the best approach, folks. We've had incredible results through the years, but we just want to emphasize, if you have more serious issues, like I said, we need to be more aggressive, 6 a day. Okay. Now, a couple other questions come up all the time with this. Will this interfere with birth control? I hear that quite a bit. The answer is no. We just, again, want to take it at least an hour apart from birth control. Again, birth control works on a different type of estrogen. Okay. So if you are transitioning off birth control, though, we know the hormones are always out of balance at that point. This would be fantastic for that. Okay. The other thing is flipping it around, though, will this help as far as fertility? And the answer is yes. Okay. So we've helped many, many females. Before you go the expensive route and doing all that other type of therapy that's out there, we would recommend 4 things. So I just wanted to briefly talk about those. Again, absolutely, this would be number 1. Number 2 would be Women's Complete, which we just talked about, 4 a day if you're trying to get pregnant. We would also recommend this formula right here, Testo 180. So for females, we would just recommend 1 capsule of this in the morning. Okay. There's a lot of great research on this for both men and women. All right. We'll talk about the men tomorrow. We'll be doing a whole talk on that. We would also recommend our active B12 folate. There's a lot of tremendous research coming out about folate, specifically folate, not regular folic acid, but folate for fertility. And this is our formula that has the most folate in it out of our entire line. So it would be 2 a day for females. And then zinc as well, which also helps on the hormonal side. I know it will strengthen your immune system, but it also has excellent benefits for hormones. So those 5 things, Women's Complete, Astro Cleanse, Testo 180 caps, Active B12, and zinc. If you could do all 5, give us 3 to 6 months, okay? And again, we've had some great clinical success with this on the fertility side, okay? Now, another question, let's go back to the Astro Cleanse, comes up with this. Can men take this? And the answer is yes. Okay, because what happens is that for some men, as they age, their testosterone levels drop, but their estrogen levels rise. So they get characteristics as far as enlarged breasts, they have a rounder belly area, obviously low libido, low energy, moody, irritable, right? So we call this male andropause. So it's interesting, for men, they call it menopause. For women, menopause, but for men, they call it andropause. So this is typically 40 and up, although there are some doctors I'm working with now, they're starting to see this even men in their 30s. So men know about testosterone, right? And that testo capsules would be fantastic, right? At 4 capsules a day. But if they have high estrogen, it's actually blocking the testosterone from actually getting maximum benefit. So if that is the issue, men absolutely can do this as well. The same dosage, 3 a day for 3 months, and it'll make any testosterone formula be that much better, that much more effective. So again, I know a lot of guys don't think about this, but it's a big, big problem out there. All right. So again, just want to point that out for men too. Now, at the end of the day, when we are pulling that bad estrogen from the body, usually this is where one area where fat tissue accumulates is in this bad estrogen. So even though we typically don't promote this as a weight loss formula, we get a lot of females and men too who do notice that when they do take this, they actually do lose weight. So obviously it depends on every situation is different, and the heavier you are, the more you would lose. But I would say clinically speaking that most women, they typically lose between 5 and 10 pounds in one bottle if their estrogen levels are out of balance. So that is what we call a positive side effect. Joe Messina always talks about that, right? A positive side effect is losing weight. So that also helps motivate females. They're feeling better. Their hormones are getting better. They're losing weight. All that can happen with this one formula. So it is very unique on many different levels. But at the end of the day, everybody has a little bit of bad estrogen. I mean, we just can't avoid it. Plastics in our environment, in our food, of course, where they're making the food supply out of, the water, medications, right? All these, what we call foreign estrogens, called xenoestrogens, accumulate and add up. So anybody can really, if they want to protect themselves from these, with just one capsule a day, totally safe. Forever, you could do one a day on that. So when we start going from 3 down to 1, you could stay at 1 a day and really protect yourself, again, especially if you're exposed to these type of foreign estrogens all the time. Okay, so again, if I had to pick one thing, this would be it. All right, now for females, a lot of females want fast results, right? Very, very quick results. So if they're having, any of those type of issues, from menstrual cycle issues to the hot flashes and night sweats, are number one to give you immediate relief, or I would say as close as we can hide in that. Hold on one second, just lost my thing there. Let me go back to. Can you get Phil for 1 second? Get Phil. Hold on, I have a little technical difficulty here. But you can kind of see it there. It's kind of highlighted. So this one formula, Enderkin Tincture, will give you immediate relief. So it just kind of went blue here. So bring it into Master Phil. Thank you, sir. Clean it up a little bit. All right, so this Enderkin Herbal Tincture. Now let's talk about this, because this is a little bit under the radar. It's one of the few little diamonds in the rough, so to speak, in our entire line. But this is our fastest way that we can help you with those kind of hormonal issues. So, and the other thing you have to think about a tincture, the way a tincture is made, it's extracted, and we're using the highest level you can have in the industry. And because it's a liquid, it's also gonna work the quickest as well. Now, we do recommend taking this straight up first and then washing it down with water or any liquid. Or if you need to dilute it, you can always put it in a quarter, like 4 ounces of water, dilutes the alcohol by 70%. So we use alcohol as a base, as a preservative in this, also to help out with a little bit more absorbability as well. So you have a lot of different herbs in this. You have Siberian ginseng, you have kelp that helps on the thyroid, you have salpimento that helps on the hormonal side as well. You have astragalus in here, okay, alfalfa leaf, prickly ash bark. But the most important thing in this entire formula are the last two for these kind of menstrual issues and hot flashes and night sweats. So black cohosh is a fantastic herb. Again, been around hundreds and hundreds of years for all these kind of issues here, but especially menopause and hot flashes and night sweats. And then we get to chase tree berries. And again, right, sometimes called the women's herb. So for any of the other type of menstrual issues, fantastic. So we put this all together in this one formula, Enderkin Tincture, right? To give you that fast acting temporary relief. The way I get the best clinical results with this would be 1 dropper full, right? So sometimes it's challenging to fill those all the way up. So 2 halves equals 1 full dropper. Okay, breakfast, lunch, and dinner, 3 a day. Breakfast, lunch, and dinner until the symptoms are gone. Which I've seen it work in a day for some. I've seen it in 3 to 5 days. All depends on the severity, how long you've had it, and how bad the issue is. But once it's better, once it's improved, we're done with this, right? So this is only temporary, only as needed, all right? So if I could do 2 things, Endocrine Tincture will give you that immediate, quick-acting, fast-acting relief. And then the Astro Cleanse will give you that long-term relief to actually help rebalance the hormones. So if you can only afford one thing and one thing only, it would be the Endocrine Tincture, okay? But I always tell a female, listen, guess what's going to happen next month? Same thing, right? So if we don't do it, combine this with the Astro Cleanse together, right? These two work hand in hand. It's a fantastic package, fantastic bundle, right? So short-term relief with the Endocrine Tincture, long-term relief with the Astro Cleanse, putting it all together, okay? So that's how we look at the majority of issues that you commonly have. Now, the other one that comes up quite a bit is menstrual cramping, okay? So yes, the Astro Cleanse will help, but again, if we want quick acting, fast relief, then we recommend this formula for any type of cramping. So whether it's menstrual cramps, whether it's Charlie horses, whether it's spasms, right? Any of those tight muscles, anything like that, this is fantastic for if you take the right amount, the right dosage. Okay, so let's just take a look at it. What's in it? So it has the magnesium and calcium, but in very specific ratio, 2-to-1 ratio, which is specific for these kind of cramping issues. And we're using the bisglycinate form there, the Trax, the Albion form, which we just talked about at the beginning with the Women's Complete Multi. You have GABA, which is focusing on the brain side. So the pain-brain connection, very, very unique. Also helps calm the brain down if you're having these type of issues. And then we have the herbals in there, chamomile. We have lemon balm. We have malic acid. So this is also great for things like fibromyalgia. You have passion flower and valerian, right? So you have some very powerful herbs in there, very relaxing, very calming herbs, combined with the minerals, magnesium, calcium, combined with the GABA. It's a very unique formula, folks. The way we would recommend this would be 4 capsules at once, all 4 at once. And just based on what I hear in the field, working with all different types of practices, usually works in 30 minutes or less. Okay. If you are super sensitive to vitamins or medications, then I would just start with 2. Start with 2 and then build up from there. If you only have these issues at night, right, then we would just take this right before bed. Some people love this one more than our sleep time for sleep because of these very relaxing herbals. So again, with these kind of issues, you have to experiment a little bit on the dosage. But again, what I find most is 4 capsules work extremely well. So that is on those kind of issues. Okay. One of the other things that we also get quite a bit is headaches and migraines. Okay. So the old joke, have a headache, right? But seriously, if you have a migraine, if you have a headache, it can be very debilitating. So one of the quickest things that we could try, and we talked about this yesterday at the round table, is our full spectrum hemp extract cream, our CBD cream. And we also have these available in samples as well. But how this would work for headaches and migraines is you would just do 1 pump. You put it on both fingertips, right? You rub it on your temples, rub it in deep, and also behind your ears. And I've had several cases of severe headaches and migraines that this worked in 15 minutes or less. So again, folks, if you're near the area and you are having these kind of issues, you can come on in. We can give you a sample. You can try it right here. And again, we've had a lot of positive feedback with that. And we would know in one dose, by the way, one sample, we would know in 15 minutes or less if that does help you. Another thing that's great for headaches and migraines is just very simple magnesium. Okay, so again, this is one of our top formulas, helps on many different issues. Okay, but again, when we look at what's in it, we have the combination of 3 different forms of magnesium. Magnesium malate, magnesium bisglycinate chelate. Okay, both of these again are that albion tract form, the most absorbable magnesium out there, and then magnesium taurate. And this also will help on cardiovascular, have some cardiovascular benefits too as well. It'll help with blood pressure. I mean, numerous benefits. The majority of people are deficient out there. So again, one of our top formulas. But for headaches and migraines, I would recommend 4 capsules at once. And again, it takes a little bit longer than the relax. Typically, it helps. It takes a couple hours, but we'll know in one bottle if this helps. Okay. If you prefer liquids, we have the next best thing. We came out with the powder earlier this year. It's a really nice lemon lime flavor, and it's effervescent, which helps with the absorbability of the magnesium as well. So not with the powder, you have some more room. So you have the magnesium, which are exactly what's in the capsules. Actually, it's even a little bit stronger. Okay. You have the calcium in there. We have some potassium in there as well, and you have some vitamin D. And by the way, 25 micrograms is 1,000 IUs. The FDA now wants us to write it as micrograms. So that is the translation there, 25 micrograms, 1,000 IUs per scoop. And again, one scoop usually does the trick for any of these headaches, migraines, heart issues as well. So we have the relax, or we have the magnesium by itself in the capsules or the powder. Okay, so I think we've covered quite a bit today. So let's just review, right? So we have the Women's Complete. We have, going back to the beginning, basic foundation. If you have any type of hormonal issues, we have the Astro Cleanse. Okay. There's one more that I failed to mention, so let's review that. From an omega standpoint, the krill oil, okay, which is a combination of 3, 6, and 9. The krill actually has more research for menstrual issues than regular fish oil in head-to-head studies. So we actually listed that right here, so we can see obviously brain, joint, but look at there, folks, PMS support, right? Hormonal aspects of it. So the research does indicate that we experience less abdominal swelling and discomfort, right? During the menstruation cycle, so alleviate cramps, water retention with mood. So from an omega standpoint, the krill would actually be better than omega. Now, omega has great benefits, absolutely. But what we don't want to do is we don't want to mix the two. We don't want to combine krill with omega-3D fish oil, because the research shows that actually they both compete with each other and you're not getting maximum absorbability. So I would do either one or the other. But if a female is having some of these issues, I would recommend the krill from an omega standpoint at 2 a day. 2 a day. These are also much smaller than the regular soft gels. So if you're having challenges with that aspect, again, krill is fantastic, but we just don't want to mix the two. All right, so the krill on a hormonal aspect, absolutely. Again, testo can help with libido, just 1 capsule a day, or fertility. Again, on the fertility aspect, the active B12, 2 a day. Super zinc capsule, just 1 a day. If you're having any of those menstrual cycle issues, you need immediate relief, the Enderkin Tincture, right? 1 dropper full 3 times a day. If you're having any cramping issues, the Relax would be my number 1 go-to, 4 capsules. If you're having headaches or migraines, again, the CBD cream, temples and behind the ears. And if that doesn't work, then we would just go straight magnesium, the capsules or the powder, okay? So we touched on a lot of different issues. They're all in special, folks, this week at the Wine and Wellness Center. Either come on down or email or call in. But again, if you've never tried these, give this a chance. That's all we can ask. You can come on in. We can talk about it more in detail. Or if you want even more, as I said, make an appointment with Ashley Rozzi or Jeff Nisnik. They can break these down even more. So my time is up. We have another speaker coming up at noon, a round table today. But I want to thank everybody. Thank Jamie Dorley. Allow me to come on. But again, folks, we can help. We can help nutritionally. We've helped thousands and thousands of females with these formulas. So my time is up. Have a great rest of the day. Merry Christmas to everybody. God